So tell us, anecdotally, what are you seeing in your hospital right now?
Hey, Brian, good morning. Thanks for having me back. So, since we last spoke a week ago, we've seen unfortunately, a skyrocketing of our COVID admissions to the hospital. We have about 80 COVID patients right now. And just to give you a sense, last year we had a peak of about 160 COVID patients. And more importantly, about 30 of those are in the ICU. And so even though this variant Omicron might be more milder, and you and I discussed that data this week from CDC and Kaiser Southern California showing that Omicron patients require hospitalization for about 3 days less than their Delta counterparts. The rate limiting factors are still the incredible speed of this variant and the amount of patients that are coming to the ER requiring admission. And then also the other rate limiting factor is, we have significant amount of staff that are out sick. But we have taken some steps, as we discussed last week. Last year, we had that code team, and we're bringing back that code team to respond to code blues on the floor, or if COVID or other ICU patients require interventions. And in addition, we have our first order of sotrovimab, that monoclonal antibody that does work against Omicron. And the California Department of Public Health this week issued a waiver that will allow ER pharmacies, will allow us in the ER to prescribe the oral molnupiravir and Paxlovid. So these are steps that we're taking that will definitely be a game changer as far as reducing those hospitalizations and deaths.
Well, that's good news. Let's go into this, doctor, because a friend of mine, a healthy guy, got pretty sick with COVID over Christmas, had it sequenced, actually found out it was the Delta strain. And I bring that up because if you look at the data, and I know the media, we're all focused now on Omicron and probably whatever the next strain is going to be. Let's be clear. The stuff I'm seeing from the Midwest and out West, and you guys tend to lag us here on the East Coast by a couple of weeks, Delta is not gone. And it appears that's the real still threat. I know Omicron may be a lot more mild for the vaccinated, but Delta's not gone away. And this is really the threat, and we sort of ignored it in the media for the latest strain.
Yeah, I 100% agree with you. I mean, I think we were, deceiving ourselves if we didn't think that we were going to have a Delta surge this winter anyway, before Omicron came on scene. And as you mentioned, in the Northeast and Midwest, and certainly us out here, we had that Delta surge. It was a surge and then a plateau, and then the Omicron kind of took off from that Delta crest. And, I suspect that a lot of our ICU hospitalizations right now at my hospital in Los Angeles are Delta related. I mean, a lot of these patients have been there for weeks, if not months. And so that's why in particular in LA, we're actually seeing an increase in our daily deaths as well. And I think that is certainly Delta.
And I want to highlight a little bit of positive news, but a tough time for so many people for going on 2 years now. I mean, it's just been devastating for so many families, especially families with kids. Let's highlight a little more of the positive news. A huge Kaiser Permanente study, not a couple hundred people, I think it was 70,000 people in the study, shows that thankfully with Omicron, that even with hospitalizations, the length of the stay is cut down by like 70%. I think the average doctor was like 1.5 days versus 4 or 5 days. Are you seeing that even with the people who are admitted, that they are able to leave sooner or get better quicker?
Sure, absolutely. I think that's what we're seeing as far as the high turnover of those admissions that are likely Omicron, that require a hospital stay of just a couple of days versus, 5 or longer, as they saw with Delta, where they received some supplemental oxygen, perhaps some other antiretroviral treatments and other drugs that we have available for them in the ICU, and then they go home. But again, it's certainly the speed, the trajectory of having so many of those that even though they require less number of days to stay in the hospital, you still need a nurse to staff that bed. And, it's been a tough time for us as far as nursing call outs because of sickness. And, it's not just the nurses, it's the respiratory therapists, it's the docs, it's the janitors, it's the support staff. It's going to be a rough month for us. And even if we peak at the end of January, you still have the back end of that surge for the rest of February.